main topic. And if you think there are few things that you really need to talk, then please post your queries. Stay in the session, just listen what Dr. Lakshmi is saying and what she is the whole new protocol process, the new things, the new techniques. We'll discuss each and everything in detail. So, Dr. Lakshmi, to start with the main topic, egg freezing and embryo implantation process. So, first of all, let's discuss about egg freezing. We know it's a fad thing now because many celebrities, many Bollywood celebrities, Hollywood celebrities, all are doing this. But do we really need this process? And uh, age is the reason that we obviously going to select this, or there are many other medical issues also. If we are having these medical issues, then egg freezing is for us, is it so?
Yeah, so egg freezing basically can be divided into two main categories. That is, why do women have to freeze their eggs? One is social egg freezing. That is what majority of the people are doing. Like, it can be divided into freezing for medical reason and also for social reason. Social reason means we know that now because of the late marriage, and they cannot find a right partner at the correct age, and also maybe they want to improve their career and their education. So all this, nowadays the women are more into education and career, so maybe they get delayed in their marriage and childbearing process. So as we know, the fertility is very closely related to age. Like, as age advances, especially in females, the ovarian reserve comes down, and this change happens especially after the age of 35. It starts declining rapidly after 35, and after 40 the decline is very very fast. So we all know, many times we see patients coming at 40, married after 1 year or married for 6 months, and they want to try with their own eggs. So because at that time their AMH is less, their ovarian reserve is less, the chance to conceive with the self X will be very, very limited. Of course, the chance is there, but we know that as age advances, the fertility potential also decreases. So the women need to be aware of this fact first, because they have this facility now to freeze their eggs at a younger age. Because if they cannot plan the family, or due to any reason, any social reason, whether it is financial security or job improvement or career or other reasons, they can freeze the eggs at a younger age. This can benefit them in many ways, because the egg quality as well as the quantity both goes down with age. So if you're freezing at the age of 35, then your these eggs are very very fertile, and the potential for implantation is also very good with this younger eggs. So as age advances, the DNA damage comes to the eggs, and which we cannot control now because it happens naturally. So there are various methods to increase fertility, but the natural process is there always. So we cannot, man cannot conquer this. Like, we cannot get over this natural process. So one is social egg freezing. Another important arena now is fertility preservation in cancer patients, because we now know that cancer treatment and survival is very good nowadays. Many young patients get cancer, and they get treated, and they can survive, and they can later plan their family. So many of the drugs or the surgeries and during the cancer can damage the ovary and reduce their capacity to produce eggs. Many of the chemotherapeutic drugs can damage the ovary. So before that, like, they can freeze the eggs. This is a very good thing, and every oncology specialist should counsel younger women about, or even younger or even teenage girls also. This is not egg freezing for the younger girls, because but they can do ovarian tissue cryopreservation also. So that is another new thing which is coming because of the improving survival and other treatment facilities for cancer patients. So that is another issue, another one for fertility preservation in oncology, or breast cancer, any cancer, ovarian cancer at younger ages. Before the treatment, they can preserve their eggs, and it is like within a few days we can. There are certain protocols which we can start as random. Anytime we can start their stimulation and freeze the eggs as fast as possible, and then they can do the cancer treatment. Another thing is like where in medical reason for egg freezing is endometriosis. Like you might have heard of endometriosis. It is quite common among Indian population. So these are the cysts in the ovaries. So before surgery they can freeze the eggs, and then they can undergo the endometriotic surgery or the cyst surgery. We call it as chocolate cyst normally. So many a times we see patients come after the surgery, after the chocolates is removal, and we see the ovary reserve has come down drastically. So they are not aware actually. So they can freeze the eggs before, and then they can undergo the surgery. So after the surgery, maybe they may produce one, two, hardly any eggs. So that is another condition where they can preserve the eggs before undergoing any surgery in the ovary. And another one is some chromosomal abnormalities like Turner's, Turner mosaic. They are prone for premature ovarian failure. So they can also preserve their eggs before, because they can go into ovarian failure at a younger age. So there is basically medical and social reasons. The celebrities, maybe they are doing it for social reasons. Of course, the new age women also can do egg freezing for social reasons, because they may get married maybe at 35, 40. So at 30s they can do the egg freezing. It's relatively simple procedure, and the survival